Welcome everyone, and thank you for joining us for Contact Lens Health Week. We're live for the next 20 minutes to answer your questions. I'm Ashley Andujar, your moderator for today, and I'm joined by CDC expert Dr. Jennifer Cope and CDC partner and ophthalmologist Dr. Tim Steineman. So Jennifer is a medical epidemiologist with CDC's Waterborne Disease Prevention Branch, where she leads the Healthy Contact Lens program. Tim is an ophthalmologist with Metro Health System in Cleveland, Ohio, and has over 27 years of eye health experience. Last week, CDC released a report that describes the cases of people who develop serious eye infections related to sleeping while wearing contact lenses. So today we're going to talk about some of the report's findings and also provide prevention tips for people who wear contacts. So Jennifer, can you tell us more about the findings in this report?
Sure, Ashley. So last week we published this report describing 6 cases of contact lens related eye infections among people who reported sleeping in their lenses prior to developing the symptoms of their infection.
Okay. And can you talk about some of the examples of the cases that you reported?
Sure. So one of the cases was a 59-year-old man who went on a hunting trip, and while he was on that hunting trip, he slept in his contact lenses. And upon returning home, he developed symptoms of an infection. And in fact, that infection was so severe that he had a perforation or a hole that developed in his cornea, which is the outer surface of the eye. And that perforation actually required urgent surgery to repair the eye and save his eye and his vision. And fortunately, he did end up recovering his vision, but it did take some pretty extreme measures to do that.
Wow, that sounds painful.
One of the other cases was an 18-year-old who wore decorative lenses, or lenses that change the color of the eye or the appearance of the eye. They don't necessarily change or have a prescription in them. And he wore those while sleeping as well, and developed the symptoms and signs of an infection. He required antibiotic eye drops, and that sometimes had to be administered hourly for several weeks to help clear up his infection. Fortunately, the infection did resolve, but he was left with a scar on his cornea.
Wow. So Tim, from your experience, what are some of the worst cases you've seen of patients that have gotten infections related to sleeping in contacts?
Ashley, the worst cases that I see are people that get blinding infections. And blinding infections are things that we could treat. I'm an ophthalmologist, I'm a cornea specialist. But I want to emphasize that it's a heck of a lot easier to prevent these problems than it is to fix them. I mean, I do corneal transplants for people that have blinding complications after an injury, which these can lead to. But let's not go there.
Agree. So I wear contact lenses. I've been wearing contact lenses since I can remember, forever. And sometimes I'm watching TV and I fall asleep, 20, 30 minutes. Is napping harmful to your eyes? And if so, what's really going on when you shut your eyes and you have contact lenses on?
Sleeping at night, napping in the lenses, it's all the same. It's a disruption of the normal health of your eye. A contact lens is a piece of plastic. It fits over the cornea. The cornea is unique in all the body. It has no blood supply. So how does it get the oxygen to breathe? It gets it from the atmosphere. And so when you have a piece of plastic over your eye, then you close your eye over the top of that, you've really deprived your cornea of oxygen, which is essential for the health of the cornea. On top of that, the lens may be coated with germs. Those germs can jump from the lens onto your cornea, hence the infection that we worry so much about.
Got it. Okay. I'm going to be watching TV with glasses. So, Jennifer, what would be your advice to people who wear FDA-approved overnight contacts?
Yeah, so there are lenses that are approved for overnight wear. These are called extended wear lenses. If you're someone who wears that type of lens, or you're thinking about wearing that type of lens, we would really strongly recommend that you have a discussion with your eye doctor about the risks and benefits of those type of lenses and whether they are right for you. The truth is, whether you're wearing extended wear lenses that are approved and you're sleeping those type of lenses, or you just, have that, you fall asleep and you take that short nap, sleeping of any sort in a contact lens is a risk factor for a contact lens related eye infection and should be avoided.
Okay. So Tim, anything you'd like to add to that?
Don't sleep at your contact lenses.
Good advice. So Jennifer, I guess the takeaway from this report, what do you want people to learn?
We want them to recognize the risk that is associated with sleeping in contact lenses.
Good. So for those of you who are just joining us, we're talking about contact lens safety with CDC medical epidemiologist, Dr. Jennifer Cope, and CDC partner and ophthalmologist, Dr. Tim Steineman. So Tim, can you tell us what are some of the most common mistakes that people make when they wear contact lenses?
Besides sleeping in the lenses, Ashley, we see a lot of people that try to extend the lifetime of the lens, either to save time or to save money. People wear the lenses longer than they should. Lenses mostly should be thrown away on a schedule, usually every 2 weeks or every 4 weeks. So maybe to save money, they keep the lenses longer, but that's not a good idea. The lenses get worn out, they get coated, they get germs on them. Those coating and germs promote infection. They also, again, deprive the cornea of oxygen.
Okay. So Jennifer, what would be the advice to prevent those infections? What do we recommend?
So we would recommend that you replace lenses as often as recommended by your eye doctor, whether that's 2 weeks or a month, or if they're daily wear, that you're actually using them as daily wear. The other thing you should think about is your case. A lot of people think that case is just as good, as long as it holds up, it's fine. But actually the case can accumulate a film on it and get germs on it as well. And so that case should actually probably be replaced about every 3 months or so. Another common thing that people do that should be avoided is what we call topping off. It's a common shortcut that contact lens wearers take, which is just adding a little bit of fresh solution to the case and in keeping some of the old solution to kind of save it and not use as much. But what you should actually be doing is dumping out that old solution, letting that case air dry throughout the day, and then when you come back at night and take out your lenses, you're filling up with completely new fresh solution.
Okay. And what about mixing it with water? 'Cause I know some people might not have solution and, they just put water and put their lenses in it overnight.
Yeah, that might be tempting, but contact lenses and water should not mix. So if you find yourself having forgotten your disinfecting solution, you're away from your home, and you're tempted to use water as a replacement, try not to do that, because water, while it is safe to drink, does still have germs in it that could get on the lens that could then be transferred to your eye and possibly cause an infection.
Okay. So Tim, let's talk about costume lenses. I know we mentioned it earlier, but do the same recommendations apply, or is there anything different that people need to be aware of?
Costume lenses, theatrical lenses, sometimes generically referred to as decorative lenses, are lenses that have color to them. They change the appearance of your eye. And in many cases, perhaps in most cases, people wear them for fun. They don't wear them because they need correction. And the thing to emphasize here is that they have just as much responsibility to care for the lens and to wear the lens responsibly. So when you think about a colored lens, the lens has paint or dye in it. That's an added barrier, and that can act as a source of germs. It can also impede the oxygen that is so vital. So don't overwear the lens, and absolutely don't sleep in those colored lenses.
Okay.
Actually, I would also add that those costume lenses or decorative lenses are they're the same as the lenses with prescription in that they are medical devices, and so they should also be fitted and you should get a prescription from an eye doctor in order to wear even those costume lenses.
Okay, so it's not like people can buy them, in costume stores.
You can buy them over the counter, but that is illegal, and that's a huge threat to the health of your eye when you do that, because they don't fit. You most likely are not getting the proper instruction. You don't get any follow-up. And again, the lens that you may be buying may not be an FDA-approved lens.
Got it. Okay. So what would be our advice for eye doctors who might be watching us? How can they help prevent their patients or take care of their patients' eyes?
So I think to be a good doctor, obviously you got to be a little bit of a sleuth. So ask your patients, doctors, ask your patients, how are you doing? Tell me about your routine. Are you having any trouble? And from there, obviously do an exam, an annual exam at the very least, and then show your patients how to do the best thing for their eyes when they wear contact lenses, because the regimen is very important. It's a medical device, and if you do the right thing, you're not going to get into trouble. But for some people, that's a big if.
True. Jennifer, did you want to add anything?
Yeah, I would just add for eye doctors that when they see these contact lens related eye infections, that they should report them to FDA's MedWatch system. Okay. As medical devices, FDA monitors medical devices, including contact lenses, for any adverse outcomes. And these contact lens related eye infections are considered an adverse outcome, and they should be reported to the MedWatch system.
Okay, good. So let's go ahead and start taking some questions from the audience. Before we take the first one, I do have a question of my own. You mentioned, that water and contacts don't mix. So is showering okay with lenses, or should people take their lenses off when they're showering? Yeah.
Ideally, yes, they should be taking. Really, the water and contacts don't mix is all types of water, even just droplets from the shower. So we do recommend to limit all types of water exposure. If you do end up showering or you do end up swimming in your lenses, something you should consider is maybe throwing out that pair after it's had exposure to water.
Okay. And what about the dailies? Is wearing dailies better than biweeklies or monthlies or?
A daily single-use disposable lens is a lens that is worn one time, and at the end of the day, you throw it away. And that's a very, very convenient and a very, very healthy option for many people, particularly for people that might be wearing the lenses sporadically. Maybe they don't wear the lenses every day.
Okay. So let's see. What about swimming in lenses?
I don't recommend it, but if you are blind without some correction, goggles can help. Discarding the lenses when you get out of the water if you wear a daily disposable. And if you are a regular swimmer who likes to exercise regularly, maybe having a prescription ground into your goggles.
And any advice on the pros and cons of LASIK surgery? Because some people might be thinking about whether that's an option for them.
We see many people who have questions about, should I continue contacts or should I go with refractive surgery? That's a personal choice. And again, I would highly recommend that you talk to your eye doctor about those particular questions. There's no good study, no good answer that shows a preponderance of evidence one towards the other. You need to consider it carefully as a personal choice and make the right decision that way with the help of your eye doctor.
Okay. And what about going back to cleaning your case, because I know you mentioned it. So what's the best way? So you pour the solution in it, and do you leave it like sitting there, or do you need to rub the case and the little?
We recommend rub and rinse, and that applies both to the contact lens and to the case. When you take your lens out to clean it, put the lens in the palm of your hand, put a little bit of the disinfecting solution and rub it, and then squirt it off. Mm-hmm. Same thing with the case. Dump out the old solution, put in some new solution. Make sure your hands are clean, but obviously rub out the case and then take your solution and rinse out the case and then let it air dry upside down.
Okay. And what's the best way to prevent dry eyes? This is something that I sometimes struggle with. What's the recommendation there?
The recommendation is to use plenty of artificial tears or rewetting drops.
Okay.
And lots of people who wear contact lenses may have an assortment of irritation in their eyes. Sometimes it's from the lens. Keep your lenses clean and disinfected. Keep your case clean. But if you have just dry eye because you don't make enough tear, then add a rewetting drop or an artificial tear and use it regularly. Even though it's over the counter, tears are over the counter, use it regularly like it's a medicine. Don't wait for your eyes to start hurting. And likewise, don't use the redness relievers. We don't recommend decongestants. Okay.
So Kirsten, we have a question from Kirsten, and she's asking, how long should I use contact solution after it's open? After it's been opened? Is there an expiration date?
Contact lens solutions typically have an expiration date.
Okay. So check the bottle. And can I go until the expiration date, or should I toss it after a given amount of time after it's been open? So
let's say you are a sporadic wearer and you've kept the bottle for a while. I think probably after 2 or 3 months it's time to get a fresh bottle, regardless of whether you have some solution left in the bottle or not.
Okay.
Yeah, I would add, once it's been opened, you've exposed it to the environment and constant use. There is the chance for germs to get onto that bottle and inside it as well. So, yeah, if it, like Tim said, if it's not being used frequently, then that it's getting used up in that time, you might want to consider tossing it.
Okay. And what about, because sometimes, if people are wearing weeklies and they open it, but they don't wear the contacts every day, is there an expiration? Like, should they throw it out when the 2 weeks are done? Or if they didn't wear it daily, like, can they extend it? What's the recommendation with that?
That's a really hard question to answer. And I would say talk to your individual eye doctor how to solve that, because it depends on a lot of factors that we don't have time for here.
Okay. So is it healthy to be a contact lens wearer for life?
Yes, I have lots of patients that I see that are in their 70s and 80s and still wear contact lenses successfully.
Wow.
And they've had cataract surgery and they still wear their contact lenses successfully. So age is not necessarily the limit.
Okay.
Good routine is absolutely critical.
Okay. So this has been great information. We are about out of time. Is there anything you guys want to add that people should be aware of before we wrap it up?
Contact lenses are a convenient and a comfortable device to correct vision. And used properly, as I said, you're not going to get into trouble. But again, be mindful of the right steps, and to all wearers, take ownership. There's no other medical device that requires as much buy-in on the part of the patient. Take ownership of your lens wear.
Okay. Yeah, I would add that prevention is key. These infections are preventable. We do have people like Dr. Steinemann who can help treat you if you get one of these infections, but you don't want to have surgery on your eye if you don't have to, if it was something that was preventable. So follow some of these easy steps that we talked about today to keep your eyes healthy.
Good. Great advice. So thank you both. Thank you, Jennifer. Thank you, Tim, for your time today. If we didn't get to any of the viewers' questions, we'll be answering them in the comments section later today. If you need more information on contact lens tips, visit cdc.gov/contactlenses. So have a great day, everyone, and remember to keep your eyes healthy.